Hello and welcome to our channel. In this video, we will discuss about a new prevailed diseases in our country, that is Mucormycosis, which is a type of fungal disease. And in this video, we will also discuss about COVID-19, that why it is associated with COVID-19 and why the patients who have recovered from the COVID-19 are suffering from this fungal disease, that is Mucormycosis. So basically in this video, we will mainly emphasize on a new fungal disease that is prevailing in our country, that is Mucormycosis. So let's start. So the basic topics that we will cover in this video are, first of all, we'll talk about that is Mucormycosis, which is a fungal disease, and COVID-19, that how it is associated with COVID-19. Then next, we will talk about this fungal disease in an elaborated manner. So first of all, we'll talk about what is Mucormycosis. Then next, we'll talk about where mucormycosis comes from. Then next, we'll discuss about what are the various types of mucormycosis. Next, what are the clinical features, that is, what are the signs and symptoms of mucormycosis. Then next, we'll talk about who gets mucormycosis. Next, how does someone get mucormycosis. And next, we will talk about how can I lower the risk of mucormycosis if I am suffering from it. And next we will talk about the investigations, that what are the diagnosis and the test that you can perform if you are suffering from mucormycosis. And at last, we'll talk about who are the persons who are at the higher risk to get this infection. So these are the basic topics that. So first of all, we'll talk about fungal disease, that is mucormycosis, and COVID-19, that how they are associated with each other. So it's very important for you guys to understand this concept, that why this new prevailing disease in our country is associated with COVID-19, that what is its link and why COVID linked deadly fungal infection it is. So let's talk. So people with a severe COVID-19, such as those in an intensive care unit, that is ICU, are particularly vulnerable to bacterial and fungal infections. And the most common fungal infections in the patient with a COVID-19 include aspergillosis, or you can say invasive candidiasis. And these fungal co-infections are reported with increasing frequency, and they can be associated with severe illness and death. And the symptoms of some fungal diseases can be similar to those of COVID-19, including fever, cough, and shortness of breath, that is dyspnea. And laboratory testing is necessary to determine if a person has a fungal infection or COVID-19. So some patients can have awareness of the possibility of the fungal co-infection is essential to reduce delay in diagnosis and treatment in order to help prevent severe illness and death from these infections. And yes, COVID-19 associated pulmonary aspergillosis in people with a severe COVID-19. So scientists are still learning about this infectious fungal aspergillus. And in the past, scientists thought aspergillosis occurred almost entirely in the people with severely weakened immune system. However, aspergillosis has been increasingly reported in patients without weakened immune system, but who have severe respiratory infections caused by the viruses, including influenza. So, several recent reports describe that COVID-19 associated pulmonary aspergillosis it is. So, usually occurs in the patient with severe COVID-19, for example, the patients who are on the ventilators in the ICUs. Secondly, can be difficult to diagnose because patients often have non-specific symptoms and testing typically requires a specimen from deep in the lungs. And thirdly, it can cause severe illness and finally may lead to a death of that person. Now next we will discuss about this deathly disease which is prevailing in our country, that is mucormycosis, in an elaborated manner. So first of all we'll talk about what is mucormycosis. So let me explain you guys that what exactly is the meaning of mucormycosis. So mucormycosis, which is sometimes also called zygomycosis, is a serious but a rare fungal infection that is caused by a group of molds which are called mucormycetes. And these fungi live throughout the environment, particularly in the soil and the decaying organic matter such as the leaves, compost piles or the rotten wood. So this is the exact meaning of mucormycosis. I hope this is very much clear to you guys. Now, people get mucormycosis by coming in contact with the fungal spores in the environment. For example, the lung or the sinus forms of the infection can occur after someone breathes in spores. And these forms of mucormycosis usually occurs in the people who have health problems or take medicine that lowers the body's ability to fight germs and sickness. And mucormycosis can also develop on the skin after the fungus enters the skin through a cut, burn, scrape or other type of skin trauma. So this is the exact meaning of mucormycosis. Now next we'll talk about that where this mucormycosis or a deathly black fungal disease comes from. So already talked about that the fungi that causes mucormycosis lives in the environment. So some medical illustrations of mucormycetes says that the group of fungi that cause mucormycosis are present throughout the environment, as I have already said, particularly in the soil and in association with decaying organic matter such as leaves, compost piles and animal dung. And they are more common in soil than in air, and in summer and fall than in winter or spring. And most of the people come in contact with microscopic fungal spores every day. So it's probably impossible to completely avoid coming in contact with mucormycetes. And these fungi are not harmful to most people. However, for the people who have weakened immune system, I'm again repeating this. So people who have weakened immune system. So breathing in mucormycete spores can cause an infection in the lungs or sinuses, which can spread to the other part of the body. So this is how from where mucormycosis comes from. Now next we'll discuss about the various types of mucormycosis. So basically, as you can see here on the screen, there are 5 types of mucormycosis. That is rhinocerebral, sinus and the brain mucormycosis. Second, pulmonary, that is lung mucormycosis. Third, gastrointestinal. Fourth, cutaneous, that is skin mucormycosis. And last one is disseminated mucormycosis. Now one by one we'll talk about them in an elaborated manner in order to make it understandable to you guys. So first type of mucormycosis, that is rhinocerebral mucormycosis, that is sinus and the brain. So let's talk about it. So it is an infection in the sinuses that can spread to the brain, and this form of mucormycosis is most common in the people with uncontrolled diabetes and people who have or had a kidney transplant. Now second type of mucormycosis, that is pulmonary, simply means lungs mucormycosis. So let's talk about it. So Pulmonary mucormycosis is the most common type of mucormycosis in the people with a cancer and in people who have had an organ transplant or stem cell transplant. Now, third type of mucormycosis is gastrointestinal. So it is more common among young children than adults, especially the premature and the low birth weight infants, that is LBW, less than 1 month of age, who have had antibiotics, surgery or medications that lowers the body's ability to fight against the germs and the sickness. Fourth type of mucormycosis, cutaneous mucormycosis, that is related to your skin. So let's talk about it. So it occurs after the fungi enter the body through a break in the skin. For example, after surgery or a burn or other type of skin trauma. And this is the most common of mucormycosis among people who do not have weakened immune system. Now, our last type of mucormycosis, that is fifth one, disseminated mucormycosis. So this occurs when the infection spread through the bloodstream to affect another parts of the body. And the infection most commonly affects the brain, but also can affect other organs such as spleen, heart, and the skin. So these are the 5 types of mucormycosis. I hope these types are very much clear to you guys. Now next we'll talk about the clinical features, that is, what are the signs and symptoms of So the symptoms of mucormycosis depends on where in the body the fungus is growing. So contact your healthcare provider if you have symptoms that you think are related to mucormycosis. So first of all, symptoms of rhinocerebral mucormycosis include, so they are one-sided facial swelling, secondly headache, third nasal or the sinus congestion, fourth black lesion on nasal bridges, black lesion on the nasal bridge or upper inside of mouth that quickly become more severe. The last symptom is fever. So these were the symptoms of rhinocerebral mucormycosis. Now the symptoms of pulmonary mucormycosis. So they include fever, cough, chest pain and shortness of breath. Now next, cutaneous mucormycosis. So this includes, you can look for blisters or ulcers, and the infected area may turn black. And other symptoms include pain, warmth, excessive redness and swelling around the wound. Now next, symptoms of gastrointestinal mucormycosis. So it include abdominal pain, nausea and vomiting, and gastrointestinal bleeding. Next, disseminated mucormycosis. So this include, typically it occurs in the people who are already sick from other medical conditions. So it can be difficult to know which symptoms are related to mucormycosis. And the patients with the disseminated infections in the brain can develop mental status changes or coma. So these are the clinical features of mucormycosis. Now next we'll discuss about who can get mucormycosis, who are at the higher risk of getting this black fungal disease. So let's talk about it. So as I have already said, mucormycosis is a rare, but it's more common among the people who have health problems or who are taking medicines that lowers the body's ability to fight against germs and sickness. And certain groups of people are more likely to get mucormycosis, and these include the people with first diabetes, especially with diabetes ketoacidosis, second cancer, third organ transplant, fourth stem cell transplant. Next, neutropenia PDF icon, that is lower number of white blood cells. Next, long-term corticosteroid uses. Next, injection drug use. Next, too much iron in the body, that is iron overload or hemochromatosis. Next, skin injury due to surgery, burns or the wounds. And the last one is prematurity and the low birth weight, that is for the neonatal gastrointestinal mucormycosis. So these peoples are at the high risk of getting this black fungal disease, that is mucormycosis. Now next. Now next we'll talk about how does someone get this black fungal disease, that is mucormycosis. So let's talk about it. So people get this deadly black fungal disease, that is mucormycosis, through the contact with the fungal spores in the environment. For example, the lung or the sinus. These forms of the infections can occur after someone inhales the spores from the air. And a skin infection can occur after the fungus enter the skin through a scrape, burn or other type of skin injury. Now a question arises here that is mucormycosis contagious disease? So let me make it very clear to you guys that mucormycosis, which is called a black fungal disease, is not a contagious disease. It cannot spread between the people or between people and animal. So it is not a contagious disease. Very important. How can I lower the risk of mucormycosis? So this is very important part of this presentation, this video. So let's talk about it, that how one can lower the risk of mucormycosis. So it is very difficult to avoid breathing in fungal spores because the fungi that cause mucormycosis are common in the environment, as I have already said, and there is no vaccine to prevent mucormycosis. And for the people who have weakened immune system, there may be some ways to lower the chances of developing mucormycosis. Now I will discuss the ways through which you can, what are the ways that lowers your chances to have this disease, that is mucormycosis. So one by one we'll talk about them. So first one, protect yourself from environment. This means it's important to note that although these actions are recommended, they haven't been proven to prevent mucormycosis. So try to avoid the areas with a lot of dust like construction sites. So if you cannot avoid these areas, so wear an N95 respirator. This is a type of face mask, and while you are there. Secondly, avoid direct contact with the water damaged buildings and flood water after natural disasters. Next, avoid activities that involve close contact to soil or the dust, such as yard work or gardening. If this isn't possible, so wear shoes, long pants, long sleeved shirt when doing outdoor activities such as gardening, yard work or visiting wooded areas. And wear gloves when handling materials such as a soil, moss or manure. And to reduce the chances of developing a skin infection, clean skin injuries well with the soap and water, especially if they have been exposed to soil or dust. So these are the ways through which there will be lower chances of developing mucormycosis. Now next, very important, investigations. What is a diagnostic criteria? So if you are suffering from this deadly disease, that is black fungal disease, or simply you can say mucormycosis, so what are the tests, what are the investigations that you can perform? So let's talk about it now. Or the providers consider your medical history, symptoms, physical examination and some laboratory tests. So when diagnosing mucormycosis. So healthcare providers who suspect that you have mucormycosis in your lungs or sinuses might collect a sample of a fluid from your respiratory system to send to a laboratory. And your doctor may perform a tissue biopsy in which a small sample of affected tissue is analyzed in a laboratory for evidences of mucormycosis under a microscope or in a fungal culture. And you may also need an imaging test such as CT scan of your lungs or sinuses or other part of the body depending on the location of suspected infection. So these are the various tests that you can perform if you have any doubt that you are suffering from. Now, last part of this video, very important, that who can get this fungal infection. I have already discussed this in this part or this topic in this video, but again I want to repeat it and I will explain it in an elaborated manner so that it becomes very clear for you guys to understand that how you can get and what are the persons who are at the higher risks of getting this deadly fungal infection, that is mucormycosis. So let's talk about who gets this fungal infection. So fungal infection can also happen in the people without weak immune system. And skin infection that are not life-threatening, such as skin, nail, or the vaginal yeast infections are common. And some infections can be more serious. Lung infections like valley fever or histoplasmosis can happen in people who live or visit certain areas. And anyone can get a fungal infection, even people who are otherwise healthy. And fungi are the common in the environment, as I have already said. And people breathe in or come in contact with fungal spores every day without getting sick. However, in people with weak immune system, these fungus are more likely to cause an infection. And the people with weak immune system, let's talk about it. So infection that happen because a person's immune system is weak are called opportunistic infections. And these illnesses can be caused by bacteria, viruses, and fungus. And many fungal infections are opportunistic infections. Now, the question arises here, what weakens somebody's immune system? So, some people are born with a weak immune system or other may have illnesses that attacks the immune system such as HIV or AIDS. And some medications like corticosteroids or the cancer chemotherapy can also lower the body's ability to fight against infections. And if you have weakened immune system, you should be aware that fungal infection can happen. So learning about fungal infections can help you and your doctor to recognize them early. And this may help prevent serious complications. And the persons who are at the high risk of getting this fungal disease are people who are living with HIV or AIDS. Second, people who have or had organ transplant, cancer patient, hospitalized patient, stem cell transplant patients, people taking medications that weaken the immune system. So, this was all about who gets the fungal infection. So that's all for today. In this video, we have discussed about black fungal disease and how it is associated with COVID-19. So that's all for today. See you guys in our next video. That is, what are the homeopathic treatment for the video, that is, what is the homeopathic treatment for this black fungal disease, that is mucormycosis. So how one can treat this disease permanently by using homeopathic medicines. So till then, stay connected with us for more videos like this, and don't forget to subscribe and press the bell icon for more updates. And don't forget to comment below. And yes, thanks for watching our video. Stay safe and stay healthy, and don't forget to meditate, to perform exercises, to perform yogas, and to perform aerobic exercises, especially pranayams, daily, at least once or twice a day. Thank you so much.